Let's have Dr. Cerise come join us. Let's give him a round of applause, CEO of Parkland Hospital. Thanks, sir. Well, you get the joy of having the chance to listen to them before you come up and face the hot seat too. What's it like first? I'll give you a chance to speak to both Fred and Judge Jenkins. What's it like working with those folks, particularly the judge, when you need political support to be able to do the job you're doing on the healthcare side?
You know, gosh, what's it work like working with the judge? So the county commissioners and the judge, they appoint our board, and they approve our budget. They approve a few other transactions that we have to do. So they're not directly involved in the business, but they have great influence in it, obviously, and we're a county institution. But where I feel it more is just he's personally invested. He talked about going into the communities and understanding what they're dealing with. I mean, to see the judge work during the Ebola crisis, I think it was an inspiration to not only the entire county but the country. And I mean, it's just, he's in some ways my boss. So but this is not blood smoke. I mean, he did things that made people trust the leadership, where he would step in and hugged people that people were afraid to touch, and that is the kind of leadership he takes to looking at our issues as well, on a day-to-day basis. Just what do we need to do to make things better for people? He's an unusual politician in my view.
Yeah, give us the arc of the story of Parkland and the turnaround there. Tell us sort of where it was, where it has been going, and where it will be going.
Well, Parkland's always been, it's an iconic public health institution. When I was working in Louisiana, people there knew Parkland. People around the country know Parkland. So it's always been sort of one of these public health places that people around the country looked up to and respected. It went through some rough times. It got into trouble with CMS, was under a corporate integrity agreement. And the judge talked about changes in leadership there. We were part of that change. So people around town know, love, respect the work that Ron Anderson did there for 29 years, and really built that institution that had a lot of respect around the country. And for whatever reason, it went through a rough period. There were some legitimate safety, quality issues that the institution had to deal with. And when we came in, we didn't have to convince people that you had to pay attention to things a little bit differently. That they had gotten the shock there, and so it was a bit easier for us to institute things because you didn't have to convince people that you were going to have to do things a little bit differently. I can tell you today, if there's a place that's paying more attention to quality and safety than Parkland, you're going to have to show it to me, because it is the focus of everything we do.
Give us some of the numbers of Parkland. Numbers of babies born, number of uninsured seen, perhaps, or the scope of the volume or sense of the volume of services you provide.
Incredibly, it's a busy place. It's 882 beds. It stays full. Every day there are people waiting for a bed in the hospital. We'll do about 75,000 discharges a year. We'll do over 1 million outpatient visits a year. That's doctor office visits a year, over a million. Gives you an idea of most of the actions happening outside of the hospital as opposed to on the main campus. Yeah. We'll deliver about 13,000 babies a year. That's about 2 kindergarten classes a day, every day. In the ED, emergency department, on our busiest days, we had 973 people come through in a single 24-hour period. Wow. On average, we'll see 80 new medical record numbers a day through the emergency room. 80 new people to the system every day.
Wow. So how has sort of the work you have done changed vis-a-vis inpatient versus outpatient? You mentioned the 1 million outpatient lives, and one of the sort of, I think, catalyzing elements must have been the DSRIP funds through the waiver process and allowing Parkland to do more things outside of its 4 walls, so to speak. Talk about how that waiver has catalyzed some of the work you're doing and how it's supported a broader shift towards ambulatory care?
Yeah, I think it's supported and allowed Parkland to continue a lot of the work that it had been doing over the years. Medicaid funding. If you look at the population that Parkland serves, about 45% are uninsured, another 30% are on Medicaid. So 75% depend heavily on Medicaid, county, state, federal funding for that care. And so it's always, years ago in the 80s, 90s, it made a shift to outpatient services and develop these community-oriented primary care centers to take care of people in the community. Was able to make that shift well before other organizations. I tell people Parkland was an ACO before ACO term existed, and because you were doing it out of necessity. You had a big population, and in the old days of public hospitals, people came to the hospital, you took care of them, you discharged them, and then as we got better at outpatient medicine, you realize we need a place to take care of uninsured people. They can come to the hospital and go to any hospital, but they can't get their chronic care, and so you started developing clinics. Not as essentially as a way to round out your continuum of care. A lot of other businesses during that same time were developing clinics to kind of feed the hospital. You get your network and you feed the hospital business. Parkland and other public systems were developing clinics to move people out of the hospital, to get people away from the hospital. Yeah. And that's sort of the history of the public hospitals. Because you're responsible for a population and you're trying to manage that in the most optimal way possible, it's a more integrated system. And so you can sort of put your resources where it makes sense. And certainly the waiver has supported that. District funds have supported the ability to take care of people in the right setting so that everything's not having to get paid for by an inpatient encounter.
Yeah. Boy, 40% uninsured, 35% Medicaid.
45 and 30, yeah.
45 and 30, wow. Mm-hmm. It reminds me that Don Berwick will say, former CMS administrator and IHI leader, say that cheaper care, lower cost care is almost always better care, because when you have too much money in anything, you are not required to be creative and innovative and pay attention. Do you think that that's accurate?
I could talk for a few hours on that point. Because when the pressure's on, you have to think differently. And so the way that we've had to do the work over years. And listen, Parkland gets great support. Don't get me wrong. I've seen other public systems, and Parkland gets good support. But you still have more demand for services than you can meet, and so it forces you to be creative. I'll give you one example. Several years ago, one of our infectious disease doctors recognized that because people were uninsured and the people that needed long-term antibiotic use, they were staying in the hospital because they couldn't get home health care. They couldn't go to an infusion center. So she started teaching patients how to give their own IV antibiotics to themselves at home. And now, 5 years, actually probably 10 years later, 4,000 people later, that's standard of practice now at Parkland. Wow. Somebody needs 6 weeks of IV antibiotics. We teach them how to do it. They go home and do it. It's safer, it's cheaper, and they like it better because they're home and they're managing it themselves.
Yeah, wow. That's interesting. So a similar question that I asked the judge, what counsel would you give other executives, particularly on the private sector side, but also related to policy leaders, about how to kind of make it through this space where it does feel like at any given time you might have a vote in Congress or the legislature, an act by a regulatory agency that could shift the ground pretty dramatically, or there might be an election that might shift the ground pretty dramatically. How do you lead a large organization through that time of relative political instability?
Gosh, that's it's such a hard question, particularly in our business when you're so much of Parkland's business depends on those decisions, right? When 75% of your business is dependent upon Medicaid policy, when the federal government changes a rule around disproportionate share reimbursement, or there's a state decision around reimbursement, those things have a year-to-year impact on how you do your care. It's we just try to, we try to be a bit conservative in our planning, try to do as much as we can to meet the demand, while recognizing that things can change on a year-to-year basis. It does make it hard to plan for multiple years when you're in that environment, no doubt.
Well, I mentioned, as you may have seen, I think institutions are very important in our American Republic, and certainly when you look at the scope of national or nationally prominent healthcare institutions, Parkland's on that, at the top of that list of most important and most well-regarded institutions. So on behalf of anybody looking for leadership, thanks for the work you're doing at Parkland. I appreciate it. Let's give Dr. Cerise a round of applause. Thank you. Good stuff. Appreciate it, Doctor. Thank you.